Our next guest is here to help us take better care this upcoming back-to-school season. Dr. Kaur, pediatric physician from Niagara Health, joins me in the studio. Dr. Kaur, what can we take away from last year's flu and measles numbers?
That's a great question, Jen. So we do expect that fall and winter season are really busy for pediatrics because, kids get really sick in fall and winter because of all the viruses that are around. So based on the data from other countries, we were expecting to have a really busy fall and winter season, and we were preparing for that. But thankfully, our numbers were at par with the previous year. So we were busy, but we were not excessively busy. So their numbers were almost equal as previous years.
Which is great. That tells us the measures we have in place were working.
Absolutely. And then fortunately, we did not have any measles child, like any child with measles in Niagara. So we were so fortunate.
Really fortunate with that.
Yes.
However, it is really important for people to know about measles, even though we didn't have a case in Niagara. What's the best course of action in preventing measles?
So vaccination. Vaccinations is the best way to protect from measles because our vaccines are almost 100% effective in preventing the disease. So typically the kid gets the first shot at 12 to 15 months of age, which provides like 85 to 95% immunity, and then the second shot is almost like 100% immunity. So vaccination is the way to go to protect from measles.
And some similarities, except with measles, there's the rash. So really important for parents, if they suspect their child has measles, to contact.
Absolutely. So measles is very contagious. So if a parent suspects that the child has measles, it's very important for them to contact their primary care physician, because then we can facilitate talking to emergency room to put measures in place, because when this child needs to go to ER, then we need to put them in like a separate room, negative pressure room, so we need to take precautions. So it's very important for the families to contact their primary care physician or pediatrician, and if they don't have any, like let's say if they don't have family doctor, then they should just call ER and then kind of inform the ER physicians well ahead of time.
With flu, what's the best course of action for that?
So flu, same thing, vaccination. So flu shots are really effective. So our flu season starts in like September, October. So get your shots up to date. It's annual shot. And then if you think you have flu, then of course, like wear a mask. Don't go to, like kids shouldn't go to school if the families think they are sick. And then if you think someone is sick, please don't go close to them. And then when children have like flu, sometimes they are coughing. So make sure they like practice good etiquettes. Like when you're coughing, cough into your elbow or into your sleeve. And if you're coughing into your hand, please wash your hands. So hand washing also goes a long way.
With the flu shot, sometimes there's a concern that you're going to get the flu. So it makes people not want to get it.
Right, yes. So there are two types of flu vaccines. So the intramuscular one is actually a dead virus, so you cannot get flu from that vaccine. And the intranasal one is live attenuated, so that's like a slightly weakened virus, and you may get some symptoms, but they are both very safe vaccines. So typically, most people get the intramuscular injection, and they get symptoms like fever, body aches. These are the signs that your body is fighting the antigen that was in the flu shot. So they don't actually get the flu, it's just the body getting antibodies to fight flu when they actually get the flu.
And then I know we were discussing about the different strains, A and B in the shot, and it doesn't matter, right?
No,
it doesn't matter.
Yep, no.
So with back to school on the horizon, we're a month away, what do families need to know about protecting their children?
Right, so expect the child will get sick when they go to school, because again, the season gets colder, kids are in the classroom settings, they kind of spread germs. They have opportunity to spread germs because they're in close contact with each other. So make sure the vaccines are all up to date before the kids go to school. That's very important. Hand washing is really important. And make sure kids spend 15 to 20 seconds per hand washing session, because sometimes we just wash the hands like this and then finish. No, we need to wash in between our fingers, the back of our hand, our fingertips, the base of the thumb. And it can be a fun activity, like just maybe sing a song when you're washing your hands. So hand washing also goes a long way. Other thing is good diet. Make sure the kids eat healthy, well-balanced diet. That's important. And physical activity. I cannot emphasize enough that it's really important for mental health and physical health. Kids who are more than 6 years of age, they should be doing like 1 hour of moderate to vigorous physical activity every day to keep their bodies healthy.
There's often, a wonder of when should I take my child to the emergency room versus not?
Great question. Yes. So depending on the symptoms of the child, let's say if your child has mild cough, mild fever, they're vomiting, but they're still able to kind of keep things down and they're making enough pee, then they don't need to go to emergency room. These children can be managed by their family doctor or pediatrician, or if the family doesn't have a family doctor or pediatrician, then they can go to a walk-in clinic. But if the child has labored breathing, they cannot keep anything down, they not peeing, they look really unwell or lethargic, then it's always better to, then I would recommend going to emergency room.
Dr. Kaur, thank you so much for joining us in the studio today.
Yeah, thank you for inviting me here. It's really a pleasure to be here. Thank you.